Annette, how's your placement been? Because I think you were a bit worried when you were going in case of all the writing that they might be asking you to do.
My placement's been going very well, thanks. I was worried about the writing, but I spoke to my mentor at first.
Yeah.
And explained, and she was very considerate about it.
So what sort of things did she do then?
Well, she just helped me with where to write things down, how to spell certain like drug names and stuff.
Yeah, because they sound quite complicated when you first hear them, don't they?
Yeah, they do, and some of them are quite long to remember how to spell. It's quite hard.
Yeah. Was there any other bits that you were finding more difficult with the writing, or?
Not necessarily. It was more a lot of time remembering what to write and what order the words go in.
Yeah, yeah. So is there anything that you could have perhaps think about doing next time when you're in practice which would help you more?
I'd quite like to, if it's okay, to use a voice recorder at times.
Yeah.
Just to make memorable notes to myself about what needs to be written down, if I need to write it down later on, if it's, for example, handover.
Yeah, yeah.
If not, I'd like cue cards.
Well, it's funny actually because we do have a student who has dyslexia who has a voice recorder.
Okay.
And she does use it in practice. And what we did was we got we got permission from the trust. And I think the only thing she has to remember to do is at the end of every shift she has to delete the information so that it's because we have to be very aware of patient confidentiality and client confidentiality. So it is possible to have a voice recorder, so we could explore that actually for the future.
That'd be good.
That might be useful. And the cue cards, that's often helpful. Mentors can help you with that because they'll know what sort of things are happening on the wards, so they'll know what sort of procedures or what drugs are going to be used. So they could help you. So when we ask you, when you contact the ward before you go to your placement, you can always ask them a little bit more about what's happening on that ward.
Okay.
So you have a few more words and things that are actually going to be, reasonable. Okay. And how do you find handover? Because of course they're giving lots of information about different patients and clients. Is that difficult for you to note to take at the time, or? Sometimes,
if they're talking really fast, or if it's been really busy, for example, then that can be quite hard.
Okay, because I did with one student, I don't know if it would help, but I could speak with your mentors about this, but sometimes if you just take a blank sheet of paper and divide it into sort of segments, and I know a lot of the wards have these pre-printed sheets for the handover, but this is much more of a visual way of putting bits of information down.
That would help a lot. I'm quite a visual person.
Yeah, so you don't have to actually do all the writing. You can actually it just helps you to visualise more the things that are going on and those sorts of things.
That would help a lot for handover.
Okay, because isn't it? I suppose with dyslexia, it's also about a bit of organisation as well, isn't it? So it's about being organised before you go into practice.
Another thing to remember.
What, to remember all the things that you need to remember? Yeah. So when your mentors are with you, how would you like them to ask you questions? Because they might not understand what dyslexia is.
Well, firstly, I'm always open with my mentors. Like, the first thing I tell them about myself. So, and just ask any question. Don't be shy about how to phrase it, because I have trouble phrasing questions myself, so I understand what they're trying to say.
So you don't mind how they ask you
No,
things?
just if you need to know something, ask. That's the only way you're going to find out.
Yeah, okay. And you find they're normally quite receptive and quite supportive when they know that you're having difficulties?
Yeah, sometimes they need to be reminded, but that's just human nature. Sometimes you forget things.
Such as,
because my dyslexia is quite mild, I can give the appearance of not being dyslexic.
Right.
And then when I make a mistake, they're like, well, you shouldn't make that mistake. But I'm like, well, don't forget, I am dyslexic.
Yeah.
This mistake does happen. And they're like, oh, right, yeah, sorry.
Yeah, so what sort of mistakes might you make in writing then?
Spelling.
Yeah.
Or syntax.
Yeah. So the way you actually put your sentences together.
It's like, that doesn't make sense. It makes sense to me.
So it makes sense in your head.
Yeah.
Yeah. So the mentors can be quite supportive and perhaps give you a little bit more time to do your writing then.
Yeah, they do.
Yeah, especially when, the assessment books that we're using, there's quite a bit of writing in there, isn't there?
Yeah, there is.
So can you think of a way in which that might be improved?
Well, for me personally, using different coloured paper.
Right.
Having the assessment books on maybe like a cream or a lilac or a blue, I think are the most common colours.
Yeah.
So having the book like that would just make it easier to answer the questions, because it's the visual between the eyes and the paper, the contrast between black and white.
Yeah. So that might have a bearing in practice as well, because we use a lot of whiteboards in practice. So maybe we need to think about how we're writing information down about patients, for example, because we tend to rely on using white paper a lot, don't we?
Yeah, we do.
That's something that we can do at the university. You know, we can let you have a ream of whichever colour paper is suitable for you. So if you're in practice and you need, you know, you can always have some coloured paper and then copy things, you know, such as bits of note paper for yourself in practice. So that might be helpful.
That'd be very useful.
Okay, but you've enjoyed things so far?
Yeah, it's been fantastic.
That's excellent. Well, onwards and upwards, that's what I say.
Definitely.
All right then.
Yeah.
Thanks a lot, Annette.
No problem.